Okay, what I'd like to do today is demonstrate just a simple version of the Turkish get-up. So you start on your back, flat on the floor. And obviously, if you have any doubts about your ability to get up from the floor, then please get somebody to help you when you're performing this task. Ideally, you would perform this up here at the clinic and let one of our therapists assist you. But if you have somebody competent and it's fit that can help you at home, there's no reason you can't try this at home. It's called a Turkish get-up. The first step after getting down on the floor is you're just simply going to rise up to your elbow to one side. Now I'm going to choose my right side. That's step one. Step two is we're going to bend my left knee or your opposite knee from the elbow that you have on the floor, and at the same time prop on your hand. Okay, those two movements are fairly simple. The next one is probably one of the more difficult movements of this activity. So now I'm going to bear weight down on the foot that I have planted and on this hand, and I'm going to rotate my hips under until I can put my weight on that right knee. So that's step three. Step four, I'm going to come up to a half kneeling position. So I'm going to move my foot to get it into a better position, and this is half kneeling. Okay, and then the final step is to go ahead and rise to a standing position. Get my cord out of the way. And then what I like to tell people, if you can do that, then let's do the same thing in reverse. So go down to your right knee. We're going to then put our hand to the floor, move this leg so that I can pull this back through and sit on my bottom. Go down to the elbow, straighten this leg out, and go back down. So all together, up to the elbow, plant the foot, prop on your hand. You can plant your left hand on your knee, rotate so you can put your weight on your right knee, then do a half kneeling position, and then stand up. Now where people might have problems with this is when you rotate to get to your knee, where you have to pull your hips underneath you, and then certainly from a half kneeling position to a standing position. And the nice thing you can do with that is if you have a chair nearby, or if you do that next to a sofa, then you can use a sofa to help you and push off of a sofa or a chair nearby, and you can help yourself get up. But that's a great way to modify that. And so typically what we like to see is, of course what I said in the article is, if someone could start performing this in middle age and do this routinely, as they age, that they could challenge the systems that are so critical to balance and mobility. And there's so much going on in just that simple movement: coordination, core strength, separating the left from the right of your lower extremities, half kneeling position, and all the balance that goes into that whole process. But it's a simple activity, and it's a very functional activity. I mean, that's one of the things that we struggle with when we're treating older individuals. They ask us a lot of times, what happens if I fall and I can't get up? Or even if it's not a traumatic fall, I can't get up from the floor. And you can just develop those skills so that you maintain them and you keep them. Of course, if you can't do this activity right now, then we need to find ways to kind of break it down and allow you to master each step along the way before you put it back together. And so you can do that at home with somebody that can spot you and keep you safe. Or if you want to come up here and allow us to help you master this particular activity, we'd love to help you with that. So thanks for tuning in.